Well, good afternoon, folks. It's Ron Ray here with Turning 65 Solutions, and we've got some Medicare Advantage plans in the news this week. This story comes to us from Kaiser Health News. It's website knh.org. They're a pretty reputable news organization in the health insurance industry. A lot of people rely on them to get their news from. So this article is titled Two Medicare Advantage Insurers Settle Whistleblower Lawsuit for $32 million. So what that means is these two companies were sued and the allegations were found by a court of law to be true enough that they decided to go ahead and settle the suit out of court rather than risk a much larger fine and penalty and or admission or finding of guilt in a trial. First thing I'm going to do is just read the article to you right off the page. So there's none of my opinion in here. I'm just reading the news direct from Kaiser Health News. And then I'm going to go back and highlight some of the points in the article so that you can kind of get an idea of what happens in some of these plans, so that when you're educating yourself, getting ready to turn 65 and go into Medicare, you can have a little bit better idea of what you may be getting yourself into and hopefully make an educated decision. So the article starts out, two Florida Medicare Advantage insurers have agreed to pay nearly $32 million to settle a whistleblower lawsuit that alleged that they exaggerated how sick patients were and took other steps to overbill the government health plan for the elderly. The suit, settled on Tuesday, was filed in 2009 by Darren Sewell, a physician and former medical director at the two health plans, Freedom and Optimum Healthcare, both based in Tampa. Sewell alleged that Medicare overpaid the health plans after they made their patients appear sicker than they were, or claimed that they had treated patients for conditions they either did not have or for which they had not been treated. The Florida settlement comes amid growing government scrutiny of the Medicare Advantage plans, which receive higher payments for sicker patients than for those in good health. The payment, known as a risk score, has been in use since 2004. Medicare Advantage plans play an increasingly important role in our nation's health market, says Acting U.S. Attorney Stephen Muldrow in a statement. This settlement underscores our office's commitment to civil health care fraud enforcement. Overspending and tied to inflated risk scores has repeatedly been cited by government authors, including the Government Accountability Office and other critics. At least half a dozen whistleblowers have sued health plans alleging they tampered with the billing formula to improperly boost profits. The Sewell case is among the first to settle. This is the biggest whistleblower settlement involving health insurers' manipulation of their members' risk scores, said Mary Inman, a San Francisco attorney who represented Sewell. She said the settlement sends an important signal to health insurers that the government is serious about risk adjustment fraud. In a statement, Freedom and Optimum Corporate Counsel Bial Patel denied any wrongdoing. He says, although Medicare managed care is a complex and constantly changing industry in which it is common to have differing interpretations of regulations, with this settlement we have agreed to resolve the disputed claims without any admission of liability in order to avoid delay and the expense of litigation so that we can focus on providing quality care, member service, and maintaining the highest Medicare star ratings, Patel said. Earlier this morning, Justice Department accused giant insurer United Health Group of overcharging the federal government by more than $1 billion by improperly jacking up risk scores over the course of a decade. Medicare Advantage plans are privately run alternatives to standard Medicare. The plans have been growing rapidly and now serve about 1 in 3 people on Medicare, or about 20 million people. The Sewell case also alleges that Florida health plans falsely represented they had enough doctors in hospitals and other medical services in order to justify an expansion of membership, a violation of government regulations. Under the settlement, Freedom Health and Optimum Healthcare will pay the government $16.7 million to resolve the allegations of risk adjustment fraud and $15 million for the allegedly improper expansion of their territories. A group of Tampa area doctors founded the Optimum plan in 2004, which initially had only about 3,000 members but later expanded. Freedom also began as a small plan of about 5,000 members in 2005, growing to more than 12,000 just 2 years later. In order to boost revenues, officials at the health plan allegedly directed auditors to scour patient medical records in search of new billing codes that could be added and submitted to Medicare. Yet Freedom and Optimum knew that as many as 80% of the added codes they submitted in some years were unsubstantiated, according to the suit. The suit also alleged that the health plans directed their doctors to call patients in for unnecessary office visits in order to find ways to raise their risk scores. These actions resulted in more than $40 million in Medicare overpayments during 2009 and 2010, according to the suit. So, here's a part where I'm going to give you a little bit of my opinion. Remember, when you go into Medicare, there's two ways to go. Original Medicare with a Medicare supplement, where Medicare's calling the shots. Medicare sets the payment prices, the payments that they pay the doctors, and the supplements simply pay all or a portion of your share of the bill. The insurance companies have no say in the matter. If Medicare pays, the supplements are obligated by law to pay your share, and they all pay the same. The other way to go is with a Medicare Advantage plan. Now, with a Medicare Advantage plan, like the two plans described in this lawsuit, you sign away your rights to Medicare for 1 calendar year. In other words, you tell Medicare that you would like to be contracted out to this private insurance company for the next calendar year. And for the next calendar year, Medicare's out of the picture. You belong to the insurance company and you play by their rules. These are typically the HMOs and the PPOs that are going to be in your area. So what happens is the $134 or whatever you're personally paying for Medicare, you pay that to Medicare. That doesn't go away. You continue to pay it. But what happens is Medicare sends that money over to this insurance company that you've chosen, and they contract you out for the year. They say, here's the money, you take care of them, and now you play by their rules. Well, guess what, folks? The $134 that you pay doesn't pay the bills. They have to make up the difference in other ways. One way they do that is to cut the rates that they pay the doctors. So for each particular procedure or billing code, they pay the doctors a little bit less than what Medicare would pay them. And another way they do that is to deny claims. So every so often you may run into a claim that gets denied. You go to your doctor and the doctor's office says, well, we need to check with your insurance company to see if this is approved. And all of a sudden it comes back not approved. That's another way they make profits. Another way they boost their bottom line is through fraud, waste, and abuse. And that's where this lawsuit comes in. So I'm going to go through and just highlight a couple of paragraphs that I think are important to note here. The first one would be here, this Florida settlement comes amid growing government scrutiny of the Medicare Advantage plans, which receive higher payments for sicker patients than for those in good health. The payment formula, known as a risk score, has been in use since 2004. The sicker you are, the more money they make from your office visits and your doctor's office visits and your hospital visits and your medical procedures and testing. Dollar for dollar, you're worth more if you're sicker. Next would be in a statement, Freedom and Optimum Corporate Counsel B.L. Patel denied any wrongdoing. He says, although Medicare managed care is a complex and constantly changing industry, which is common to have differing interpretations of the regulations, what he means there is whoever reads the law that day can make up their mind of what they're supposed to do. There's no constants. They have agreed to resolve the disputed claims without any admission of liability in order to avoid delay. So they're just paying the government off so that they can stay in business. Earlier this month, the Justice Department accused giant insurer United Health Group, maybe you've heard of them, of overcharging the federal government by more than $1 billion through this practice of raising the risk scores artificially. $1 billion, billion with a B. That's money that could still be in the pot to pay for legitimate health claims. That's tax dollars wasted, abused, stolen by health insurers. Medicare Advantage plans specifically. Medicare Advantage plans are privately run alternatives to Medicare. This is important. You didn't just hear it from me, you hear it from other sources. Medicare Advantage plans are privately run alternatives. There's a key word right there, folks. Alternatives to standard Medicare. Alternatives to standard Medicare. You give up your Medicare benefits for that calendar year that you select a Medicare Advantage plan. Now, you can go back to original Medicare during the annual Medicare Advantage disenrollment period, which is January 1st to February 14th. But what's the catch? You have to be healthy enough to qualify for a Medicare supplement. And some people can't qualify for a Medicare supplement. So when you pick a Medicare Advantage plan at age 65 and you either already have or later develop some health conditions, you may be stuck in Medicare Advantage for the rest of your life. The Sewell case alleges that the Florida health plans falsely represented that they had enough doctors, hospital, and other medical services in order to justify an expansion of membership, a violation of government regulations. Medicare holds them to certain standards, certain minimum standards. They have to have so many doctors to serve so many people. And what did they do? They lied. They told the government that they had more doctors and more providers and more services than they actually had, so that the government would give them more territory to get more people and get more money, but didn't provide any more services. In order to boost revenues, the officials at the health plan directed auditors to scour patient medical records in search of new billing codes that could be added and submitted to Medicare, even though they knew as many as 80% of the codes they submitted in some years were unsubstantiated. So this is another way they do this. They go back through the records and they look at them and they find reasons to bill Medicare for visits that you've already made. They've already billed them once for that visit. Now they're going to go back and find an excuse to bill them again. You haven't been back to the doctor. This is an additional bill for the same visit. Here's another one. The suit also alleges the health plans directed their doctors to call patients in for unnecessary office visits in order to find ways to raise their risk scores. If you go to the doctor once a year for a checkup, well, your risk score is fairly low. But if you go to the doctor every 3 months for blood work, you have a higher risk score. So I'm seeing that in my practice, where people who, when I look at them and I talk to them and I'm learning about their health histories, now I'm not a doctor, but I talk to a lot of people every week about their health. They seem to be fairly healthy, but yet they're going into the doctor every 3 months for blood work. This is a recent development. 5 years ago, 10 years ago, these folks would have only gone to the doctor once a year or once every 2 years, and that doctors were fine with it. But now, just because they've gotten older and they're on Medicare, now they're going in every 3 months and doing blood work and testing every 3 months. No real significant change in their health, just as a preventative, because Medicare will pay for it if we do it. These actions resulted in $40 million in Medicare overpayments during 2000 and 2010, just from these two companies alone, according to the suit. So, folks, I challenge you to find a news story out there on the internet like this surrounding a Medicare supplement company. You're just not going to find them out there. When you do find stories like this, they are always about Medicare Advantage plans. You will almost never, I challenge you, to to find a story like this, fraud, waste, and abuse with a Medicare supplement. You won't find them because Medicare is the primary payer. Medicare calls the shots. Medicare doesn't like to waste their own money. I'm not saying that they don't, but they're not going to steal their own money. Whereas these Medicare Advantage plans, in my opinion, are very susceptible to that type of behavior. So as you're turning 65, you're going to have questions. Please give us a call. Our number is 1-800-515-4031. You can find us on the web at www.t65s.com, t65s.com. Again, my name's Ron, and I appreciate you spending a few minutes with us today. If you have any questions, give us a call. Thanks for listening, folks.